Aloha kako, everyone. Welcome to the Ask-A-Kauka webinar series. I am super excited today to introduce two brilliant female pediatricians to help answer a lot of questions that are swirling around in our community right now about COVID and vaccination and kids. Um, so first, I'd like to introduce a colleague of mine from the Ask-A-Kauka, the Association of Native Hawaiian Physicians, Dr. Wong Ramsey. She's a neonatologist, so she does intensive care for very little children, newborns, at Kapiolani. And so she is also on the board of Ask-A-Kauka, as I told you, so I'm really glad to have her come and join us. And the other person I'd like to introduce is Dr. Nadine Tenn. Dr. Nadine Tenn works with me on the National Council for Asian and Pacific Islander Physicians. She's one of our board members, but she's also the head of pediatrics at Queens. And both of them have a wealth of experience, and I don't want to spend too much time on introductions. I'm sure they can share a little bit about themselves, but I know there's so many questions out in the community. And I really want to have this time to let everybody get a chance to ask those questions. So I will just start off by asking each of them one by one what they're seeing within their own community. So Dr. Wong Ramsey, what are you seeing at Kapiolani with pediatrics and COVID right now in our community?
Mahalo for the kind introduction, Dr. Kamaka. So, as many of us here in Hawaii may have noticed, recent headlines have been eye-catching, talking about ICUs getting filled to capacity and hospitalizations increasing. We know that overall, COVID tends to impact children with less severe ill symptoms, but our children are still getting sick. We are seeing a number of children being hospitalized at Kapi'olani Medical Center due to COVID infection. I'm not able to provide any more information beyond that because of patient privacy concerns. Furthermore, we are seeing a larger number of pregnant women who are coming into our hospital, including Kapi'olani Medical Center, very sick. And some of these women are at very early gestational ages in their pregnancy. Some of these women, because they are coming in so sick with COVID, the physicians are having to deliver their babies prematurely in order to help preserve both the mom and the baby's life and health. Babies who are born preterm may have to go to the neonatal intensive care unit where I work and face a multitude of problems associated with prematurity, including growth or feeding problems and much longer hospital stays than their counterparts born at full term. Unfortunately, this has also impacted our visiting as well. So, a lot of hospitals have reduced the number of visitors, and this can be very hard for pediatric patients, babies, and young children who need to stay in the hospital for medical reasons. We are fortunately able to allow at least parents to come to see their children, but unfortunately, we're no longer to allow other members of the Ohana to come into the hospital, such as aunties, uncles, or other family members the way we used to prior to the pandemic.
Oh, this is just a heartbreaking situation that you've just described. You've described pregnant women that are getting infected with COVID and then having to have babies delivered prematurely to save both lives. And then now you have children that are born prematurely that have additional problems, and that all of this was unnecessary or wouldn't have been there if we had had COVID. So just a very, very heartbreaking situation that we're hearing about, and people often don't think about that as they're thinking about community and infection within our community as the impact on our pregnant women. So thank you for sharing that. Dr. Dr. Tenn, I know that you have a very busy private practice. What is the situation right now with the kids that you're seeing and the families that you're seeing in your clinic? Oh, Dr. Salle, you're muted. Yeah, we still can't hear you.
How about now?
Okay, yes.
Perfect.
Now we can hear
Perfect.
you.
No, just to follow a little bit of what Dr. Wong Ramsey discussed, I think the biggest take-home message is initially when we as a community hear what's going on, we look at what we think the impact is to ourselves and as an individual. And I think the story that Dr. Wong Ramsey was describing is how many unforeseen ways that COVID is impacting every stage and in so many different aspects of everyone's lives, and how broad and how deep this conversation goes. So just a little background, so when I tell my story, you have a sense of where I'm coming from. I wear a few different hats. I have a private practice, and my private practice is a mix. I'm one of these people, they call them med-peds, which mean I do a little bit of adult medicine, even though my practice is predominantly pediatrics. I'm one of those physicians that do see their patients in the hospital. So while I don't typically follow my patients all the way to the ICU, I do have patients that have been impacted by COVID in the hospital. And then you mentioned a little bit earlier, I play a little bit of a leadership role as chief of pediatrics at Queens. And I can see not only from across the way at Kapiolani, our pediatric tertiary center is having to deal with infants that are born early because their moms that were pregnant were infected with COVID. We're also seeing those same moms have to be transferred back to Queens for their own individual care, and the collaboration that has to go back and forth, but it's the separation of families at such an important time in their lives. I'm seeing the mothers not pregnant, or sometimes the fathers who are the adults that are being hospitalized. And then the separation of not being able to visit, I think it was alluded to in terms of that early stage of newborns. But sometimes it's actually on the opposite end, in which the families are not allowed to see their kupuna. In my office, with regard to the children, I'm seeing it mostly in terms of bulk. I'm seeing the way it has turned everybody's life upside down. For starters, beginning with the fear, do I send my children to school or not send? Grappling with the fact that I think as parents, we all appreciate how important it is for children to get their education, to get back to normal, to do all the different things that they should do, for instance, in high school, since it's almost 2 years since they've been back at school. But then what do we do with the fact that we have so many cases going on? So just that strife, and there is no singular right answer, because it really does depend whether the children are very young and unvaccinated, whether they're vaccinated, are they going to a school that has the ability to put children in pods? Then the scare of every time that there's a case in the hospital, not the hospital, excuse me, at school, the children have to be pulled out, they have to be tested. There's a period of time where you're not entirely sure, are they positive or did we test too early? So just to go back to your question, how many different ways we're seeing COVID, some just interrupting the very daily part of our lives, and some very scary where it gets into a hospital setting where it can be as intense as an ICU or a week in the hospital where you're needing a lot of support just to get better.
Yeah, it's quite overwhelming when you think of all those different scenarios and that impact in many ways. Since you raised the issue of school, I think that's a really hot topic in our community right now. Are our kids really safe? Is there enough that's been done in school to protect them? And what about kids that are going to different schools? You know, private schools have different rules than public schools. So what kind of advice are you giving the parents, especially of those that are 12 and under? And then I'd like to talk to you about what maybe the ones that are 12 and above that might be eligible. But let's talk about that younger population first. What are you telling your families?
It's a bit of a challenge because there's one language that you use to give people broadly, the public health message. But in my practice, I really have to tailor it to families' individual situation and what they should decide. But I'll try to round it out to advice that I give in general. But again, unfortunately, families have to figure out what works best for them. So the first is around the rules with regard to how does one stay safe, whether this is the Delta variant or COVID-19. There are certain rules with regard to lowering your risk and staying safe. And they're typically three. There's universal masking. There's being able to have reasonable spacing. And when you can, the more people in your family, starting right now, unless the guidelines will change in the next month or two, 12-year-olds and up, to consider vaccinating, because it makes a difference. While it doesn't make you bulletproof, it improves your risk, or just at least lowers the chance that if COVID does come into your household, it's less likely to end up in a hospitalization. So that being said, now my families have to contend, and you brought it up, and I'd like to just speak plainly. It kind of depends on the school you go to. Unfortunately, very unfairly, the private schools have a lot of things in place, very simple things, from keeping the children in pods. Some of the private schools have made it somewhat mandatory to be vaccinated to come in. So they've created a population or a space that is safer. And I often have that conversation. Where are the kids going to school? What if the school is set up? And is it reasonably safe to send them to school? So that's one. But you know what? While I compared private to public, not all the public schools are identical. So again, I have to talk to the parents. What are the schools that your child is going through? What have they put in place? Do they seem to be following the guidelines that I just mentioned? And when they do, given if their children are vaccinated, that can give you a little bit more confidence about sending your child back to school. So then I'll usually get two questions right afterwards. What if they're less than 12? And what if there's someone in the house that's medically, either medically fragile, or they have a condition, or it's just their 80 or 90-year-old grandparent that may be vaccinated, but why on earth would I take a chance with someone who's so dear to me? And then it becomes the heart-wrenching discussion. I can speak to them about statistics, but in the end, I need them to choose what's best in their heart and what they think they would be willing to live with, given that anything happens. And then I do make their decision even just a little bit more complicated. Whatever they choose may work for right now when we're in a surge, basically implying that they may decide to keep the kids home. But I do impress upon them that while we're in a surge now, it's very likely that COVID is going to go on for the next year or two. And whatever decision they make, is it sustainable?
Oh my goodness. Wow. And then your families are still like, what are we going to do?
What do we do?
Yeah, and I think it's you raise an interesting point in that not all schools are created equal. Mm-hmm. And some schools are better prepared and some schools have more resources than other. So what do you do with those families where they know, the school's having a difficult time having everybody stay masked? They don't have the ability to space them appropriately. The ventilation system isn't the way it should be, and yet we know that our kids need to return to school. And the social benefits and all the other benefits from being in person, they've really suffered this last year, over a year, and to think of it going on for a couple more years, I just like, I just can't imagine. So these are very difficult questions, aren't they? And very long conversations. I'm sure our audience is going to have more questions for you, but before I let the audience ask you questions, I can't help but want to ask Dr. Wong Ramsey about some of her moms. So you're seeing these pregnant women coming in, having to deliver premature babies. What about breastfeeding? There's a lot of there's a lot of rumors and things about breastfeeding out there and COVID and vaccinations. What are you telling them?
Sure, great question. As you mentioned, there is a lot of concern from moms out there who are nursing their keiki and concerns about whatever mom is taking. Will it affect baby? For example, we know a lot of other things like certain medicines or drugs. If mom takes it, some of it may pass through the breast milk. So their question is, how do vaccines impact the baby or the breast milk? Those are great questions. So the current vaccines that we have now, the way that they're designed to deliver the mRNA or the DNA, depending which vaccine you got, into the particular target cell, it doesn't pass through the bloodstream or get to the placenta. It's just degraded directly in that cell. So the vaccine itself should not pass through the blood and from the blood get into the mom's breast milk. However, one thing we do know about moms who receive vaccinations is that when moms get vaccinated, they develop antibodies. The antibodies develop in the blood, it's in the bloodstream, and that will pass on through the breast milk to the babies. So, this is one reason why we highly recommend breastfeeding young infants at least until the age of 6, ideally 12 months or even longer, as long as mutually agreeable between the mom and baby, because the baby is getting immune benefits from the breast milk. Breast milk is a beautiful, wonderful thing. It's a living tissue that the mother's creating that knows exactly what the baby needs. And studies have shown that mothers who receive vaccination against COVID, then they studied the breast milk samples of these women. They did identify antibodies in the breast milk of these women. They also studied these women before the first dose of the vaccine and the second dose of the vaccine, and they did see an increase in the level of antibodies that were detected in the breast milk after the second immunization that the mother received. So we hope that given what we know about how antibodies and other vaccines work to prevent the infant from infection, we anticipate that ideally the COVID antibodies that the babies are receiving from mom's breast milk hopefully should offer some degree of protection against the COVID infection for our young infant babies. Young infant babies are often too young to receive certain immunizations. That is why we have an immunization schedule for our kids, certain shots that are just not proper or safe for babies until they're a little older. And until we are sure that COVID vaccination is absolutely safe for our younger infants, one of the best possible ways to protect our babies from infection are number one, encouraging mothers to continue breastfeeding as long as they can. And another is encouraging our nursing moms to get vaccinated so that the babies can get some of the antibody protection from the mom's breast milk. There have been several studies going on with breastfed babies, women who've gotten vaccinated. Several of my physician colleagues have actually enrolled in some of my studies since, as physicians, we were some of the first people who were eligible for the vaccines when they first came out in December. So it's been almost 8 months now that some of these women have been following, and so far we have not seen any adverse impact with the babies who are being breastfed with mothers who have received their vaccinations against COVID.
So it raises, thank you so that's actually really good news. And it raises two questions that I can think of right now. One is, we know that the antibody levels drop after a period of time, and that they're recommending now that a third booster, for example, if you get the Pfizer or Moderna, 8 months out, antibody levels start dropping. I imagine the same thing's happening in the breast milk. So maybe these mothers should actually be considering getting a booster after 8 months so they can maintain this protection for their babies. Is that something that you think might be a good idea or would work?
I think we'll have to see how the studies look and see what the antibody response is after the third dose. But I think that's a reasonable hope that we hope with continued stimulation of antibody production, the mom will lead to hopefully more continued protection for baby through the antibodies in the breast milk.
Yeah. So then what about COVID? I'm sure there's somebody out there wondering if COVID can the infection itself could be transmitted through breast milk?
Yeah, great question. So, back when the pandemic first came out, there was a lot of questions about this. In fact, in China, where some of the first early infections were first seen, people were so worried that they actually didn't give mothers breast milk if the mom was infected with COVID because they were worried that the babies might potentially get sick. However, now that so much time has passed, and thankfully with science, we've been able to study this, we've shown that it's very rare to see positive breast milk positive with COVID virus particles. Those that are positive in that very small minority, it's unclear if that's enough to infect the baby. So many women who have had COVID and have been breastfeeding their babies have been studied, and of the women who do have COVID detected in their breast milk, as I mentioned, it's not quite clear if it's led to infection in the babies. A lot of these babies have gone on to be perfectly healthy and fine. So that's kind of been an unknown. One thing we do know is that keeping moms and babies together is a good thing. So in the beginning of the pandemic, we used to keep moms and babies apart out of fear
I
for the
remember
baby
that,
getting
yeah.
infected. Yeah, and understanding that was an extremely heartbreaking situation, especially for a brand new mother who just delivered her baby. And thankfully, with science and time, we've learned that the risk of infection for a baby, whether the baby stays in the room with mom or is kept separate in a separate room, there was not a significant increase in the rate of infection between the two. On the other hand, we know from many years of research that breast milk has so much benefits for the babies, both in the short-term health from a nutritional standpoint and also the long-term side. Lots of long-term developmental infectious protections for the breast milk down the line. And we know that having mom and baby start nursing as soon as possible right after birth leads to a higher rate of success in the future for continued breastfeeding. That's the general recommendation then. As long as mom is healthy enough and if baby's healthy enough too, generally we try to keep mom and baby together shortly after birth, even if mom is positive for COVID.
Great, thank you. That's a really good hint for me to remind everybody that August is actually National Breastfeeding Month. So I'm really glad that we had this conversation around that topic. And also, I think I was remiss in introducing myself. So I'm Dr. Martina Kamaka. I'm a family physician, and I'm very blessed to be able to work with our two wonderful panelists in different capacities. So my apologies for not introducing myself earlier. I would like to direct a question now to Dr. Tenn. And there's been questions about, there's this emergency use authorization, and are these vaccines really safe? And are they really safe for our kids that are going through development right now? And could we even be possibly adversely affecting their ability to have children later in their life? Have you gotten these kind of questions in your practice, and what are you sharing with them, with your
Right.
parents?
I think a lot of the questions that are being put out, I think they're fair. And what mean by that is, I don't think the general public, our neighbors, and everyone has ever had to make so many decisions about, for instance, a treatment or vaccine. And the amount of information that's coming at an individual nowadays, it's challenging. So quite often, and it can be a little time consuming, but quite often, we'll sit down with families or individual patients and try to go through just maybe taking them through the process of how we got here, and reminding everyone that this is not an infection that was in existence in the past. While there's similarities of the virus and the class of the virus existed, and that we use sometimes an analogy that it sort of behaves like the flu, except it's much faster, much more aggressive. This is unique times. The second is it's also a very unique time of how fast it moved in our community. This is not about something that we're reading on happening on another continent like Australia or Africa, and they're having an outbreak. We're watching something that is happening worldwide. And the number of patients that we're talking about, or people that are impacted by COVID, are in the billions. So the basics that we talked about before, we can start with different things that we use to try to protect ourselves, that we typically use to protect ourselves from respiratory diseases. But in the end, we needed something that would stop the movement, the transmission, and the evolution of this virus as it moved around. So to go back to your question, so without getting too specific, I tried to explain how we got here with this vaccine. It's not magic. It's not voodoo. It's not something that was rushed to market in a very reckless way. We were starting with ways to deliver medicine that we have been dealing with or been using for decades. What is new is to use it for a vaccine. But even the development of being able to have something specific for the COVID vaccine, that is not new. What is new is combining these two together, still using safe science that we had before, and then needing it ready for the population much faster than we've ever had before. And unfortunately, the time, I think what we've always thought is in time that it's safer because it takes 5 years or 10 years, a lot of it was bureaucracy. And a lot of this shortcuts that we've gone through is eliminating the bureaucracy, not necessarily eliminating the safety. The other thing is typically these studies that we do for vaccines are done in very small groups, maybe 1,000 people here, 1,000 people there. We now have 4.5 billion people, I think it's 4.3 billion people who have taken these vaccines. So never before, one could argue, has a vaccine been tested on such a large scale, albeit a shorter period of time. Very scary, but the more you know, the less it feels like voodoo. The two vaccines that I'm actually going to focus on one vaccine. And the reason I would focus on one vaccine is because it's the one that the kids are going to get. So let's just talk about the Pfizer, and let's talk about the mRNA. Again, it's not magic. It deals with a basic premise. Our immune system works the way it is by recognizing something. We either recognize it because we had it, like the chicken pox, and then the next time the chicken pox comes in the room, even if we know it, we recognize it. It's like the bad boyfriend. You can see him from across the hall, and you prepare yourself. You're like ready for whatever they're up to. And hopefully, because we started with a strong immune system, dealing with most healthy kids, that extra edge of recognizing in advance allows you to fight it off. And it's the same basic premise for the mRNA. It allows you to, the mRNA vaccine, the Pfizer, allows our body to create this little signal. We call it a protein, and it's the S protein, but it is the identifier, so that our body recognizes the COVID without having been sick by the COVID. And that's why it is actually safe for the general public. That's why that same science allows us to look breastfeeding moms in the eye and say, yes, it's safe, because we know that the only thing that has been altered is your body's ability to recognize that S protein on through the vaccine. So I try to start there. So we take away the voodoo and the hocus pocus around it all, so that when families finally decide, am I going to do this for my family, they can at least feel a little safer. I will tell you, I'm a mom, and I think all three of us are, and I do not take it lightly when we start to talk about infants. It's one thing to talk about adolescents, because I think, I don't want to speak for all of us on this panel, but I think we kind of feel that we know and we understand that for the most part, adolescents respond to vaccines in a very similar way to adults. So if it's been working well for adults and we have a good cadre of the side effects that they're likely to experience, while there may be a little bit of difference, we can feel fairly safe. But stepping outside our pediatric role or physician role, all of us have a little angst and a bit of pause when it comes to pregnant women and newborns. And I understand that. And Dr. Wong spoke a little bit about the science. How do we know it's going to cross over and not cross over? We can clearly tell that with regard to breastfeeding. And that's why we can look breastfeeding moms in the eye and say, you can take it. When it comes to our pregnant moms, the way the mechanism works, we can say there doesn't seem to be any science that would imply that the fetus would be affected by this. The fetus is going to respond to, your unborn baby is going to respond to the antibodies, but we should not be in any way impacting the baby or the baby that's growing. But then what about the little kids? Their immune system, and we all know this, we were all taught this in med school, they respond to vaccines differently. That's why we can't give certain vaccines to newborns and toddlers. We have to wait until they're a certain age. Right now, I may be oversimplifying it, but all the studies show, and there's areas like Children's Colorado, as well as Arizona, they've done some fairly large studies with children down to 6 months of age. There doesn't seem to be any problems in terms of adverse effect for the newborns, the toddlers, and the preschoolers. What the question seems to be is, what is the appropriate dose and the timing for giving the children so that they will develop the appropriate antibodies, not so much the safety. So I share with that, and then I also, wait for it to actually being approved, that we can actually talk to our parents that it's safe now and enough studies have been done.
Great, thank you. I appreciate you going through that wonderful explanation of the vaccine and how it works. And I think one of the things that is going around in the community that you kind of help at least make me feel like I understood it better, there's that concern about, will it affect the DNA of my children? And I think you've just explained that it doesn't get into the DNA. But did you want to expand on that a little bit? Because there is a lot out there about DNA. Both of you, if you want to pipe in about that, can this vaccine change our DNA?
Should I take a crack at it? We'll go back and forth, Cara? Okay. Pardon me for not being too academic, because I think if I really get into it, it's a little bit too much. I'm going to give kind of examples of how it works and explain it in that manner. And what I mean by that is, because what you just said is, is it going to alter my DNA? Well, theoretically, nothing really alters your DNA. That's set, but one thing that can happen is, how shall I put this? Well, for starters, it is an mRNA vaccine, not a DNA. That's for starters. And the mRNA is a way that our body does things and gives, it sort of creates communication back to our body. So the mRNA vaccine has a way in which, yes, it is introduced to our mRNA. And when we introduce it to the mRNA, it tells our body how to create the protein so that it will recognize the COVID virus when it sees it. But it does not alter my DNA when I think of what makes my eyes brown and my hair curly, and any children that I might have in the future. Those are actually two separate things. And when you ask the question, it then sounds as though people are taking these words and they're assuming they're the same thing, when they're actually two separate things altogether. So when we think of the DNA is what makes you a monkey, what makes you a zebra, but the mRNA is another thing altogether. And that's the way I would try to answer it. Dr. Wong,
thank you for explaining that, because I do think that's what people get the two mixed up, and they don't realize that the vaccine does not interact with the DNA at all. It doesn't encounter it. It doesn't communicate with the DNA at all. Yeah. So Thank you for that beautiful explanation about
The
that.
M is the messenger part of the, but go ahead.
Yeah, that was a great
Yeah.
explanation. I think the only thing I would add is that FDA does expect to give full approval for Pfizer's vaccine. They're just going through some of the paperwork and logistics. But from a safety standpoint, the FDA has reviewed all the data and they do feel that is a safe vaccine and that will be approved for full FDA approval very shortly.
So that may help some of the people in our community that were a little, maybe a little nervous because they're like, oh, this is emergency use only and not fully approved. So that's great news that as early as possibly next week, we may get full approval from the FDA. So I wonder, does that full approval, will that extend to children? Or is that just for adults?
I think those are two different things. And I'm glad you brought that up. I think the approval is for what is already in place. So it's approved and it's approved down to 12. What we do expect is the next step will be that it'll be approved down to 5 years old. And rumor has it that they plan to lower the age to 5 years old in the next month or two. Now, when they do that, it will be with FDA approval. But what we'll put out on Monday, I think, is just approval of the vaccine itself.
Yeah. I think there's also some confusion in the community. When we say FDA approval, emergency use authorization is still FDA approval, right? And yeah, so
I'm going to interrupt just a little bit. Do you remember a little earlier we were talking about that fair that everything was rushed and we were cutting corners? And I brought in just a little bit about, historically how drugs and vaccines and such actually go through the FDA. Do you know, it was about 10, 15 years ago, the United States realized that their approval process for things was very cumbersome. And the question that people way smarter than me asked is, well, what if something really bad happens and we needed to put forward something really fast? And what they did is they put in the framework of having something that can be fast tracked. The importance of that was not fast track and cut corners and cheat, but not force it to get in the usual post office line and wait until the usual approval, recognizing that something needed to be done very fast and very efficiently. The second thing that usually causes vaccines and drugs to take a long time is funding. Typically, it's one company or one corporation that is trying to move a single drug forward, and it's basically to their benefit. What is unique about this time, and it was part of the preparation of getting all these different corporations, is for a moment in time, many large drug companies or drug corporations were told to focus their money, time, and research on this single thing: get a vaccine approval, get a vaccine designed and get it ready for, the world, essentially. That is the speed and that is the focus, not necessarily, again, that implication that fast implies that we're cheating or cutting corners.
thank you for discussing that, because I know that there are people out there that were really concerned about that's what this fast tracking meant, and that reassurance that everything, protocols were still followed, safety is still important, and that they should be able to feel comfortable that this has gone through the process that it needs to reassure our public and our communities. I believe this fast tracking process for things that are of national significance, like COVID, actually may have started in the post 9/11 era.
Exactly.
Where they realized that we have to be prepared to do things differently in the interest of the national interest. So thank you so much for explaining that. Yeah. There are a couple other questions that I know are circulating in the community that maybe I'd like if either of you can kind of talk about that. And one is there's a concern that there might be heavy metals or a microchip in the vaccine. So I'm sure you've been asked that by patients. But what do you tell them about that?
You go, Cara. I mean,
I was gonna say that's more of probably a question for you in the outpatient.
Okay, okay, I'll tell two. Some things are crazy in the sense that they just flip around on the social media and such. But a lot of times I try to figure out where it may have started. You know, what buzzword then allowed people to maybe group the wrong things together. So the first is the microchip. And I think that might have gone back to your original question about the DNA and mRNA. And, you know, I'm trying to think about the average person, you know, whether or not they took biology in high school and such. And if you really haven't, all these concepts, you might bundle them together. So you might have heard that mRNA basically is going to talk to your body and it's going to ask your body to produce something. So then that might take a leap that something is being embedded in you. And then they might use the computer analogy to take them down in that direction. And what I would do is back it up a little bit and say, yes, something is speaking to your body, but it's presenting it to your body, and then your body responds to it. But it is not embedding, and it is not making a permanent change. One could argue that's kind of why in 8 to 9 months, we're all looking at waned immunity, and it has to be presented again. So I think that's where that comes from. I think the heavy metals goes back to maybe because there's a little overlap. There are communities that are very mistrustful about vaccines. And then there are people that actually have always been very, very comfortable with vaccines, but there's mistrust for this particular vaccine. One of the things that I found families and parents have struggles with that buzzword of what preservatives, mercury, what else are they putting in the vaccines? So I'm going to back it up away from the COVID vaccine and just go back to what some of the original concerns were. If you'll hear formaldehyde, you'll hear the polyethylene glycol, but all of these are considered the preservative that have been used historically to keep a vaccine stable. So just to back up and just explain, there's a shelf life to vaccines. Some have to be kept at a certain temperature and under certain conditions. Otherwise, they just become distable and you're just shooting water or something that's ineffective into your body. In order for it to be effective, it's sort of like that medicine that we all bring home, you know, when we prescribe a little augmentin or amoxicillin for the ear infection. And we got to give liquid because kids hate tablets. That liquid amoxicillin typically has to be kept in the refrigerator. If we keep it out on the porch and it gets warm, it basically doesn't work. It's the same similar concept for the vaccine. But unfortunately, to keep it in its proper mode and to keep it preserved, something has to be there. The amount is extremely small. And when we think about some of the junk that we eat and give to our children, just look at your average candy bar. We are not speaking about a huge amount. I'm going to even speak about something that is actually no longer in any of the vaccines. I'll talk about mercury, the thimerosal. The amount of thimerosal or mercury that had been used in the past in vaccine, and I'm not a fan of it, but the amount is less than we would actually get eating salmon that was wild, do you know? And just to put it in proportion and to understand that to a certain extent, we are naturally exposed to different things. So I didn't say it's not there. What I'm saying is the amount that is there is minute compared to other things that we do in day-to-day life. So I think that's somewhere where people talk about the heavy metals and the mercury, because it harkens back to, wait, what else? What are the other added ingredients to vaccines? So for starters, mercury is no longer used. Other additives are used and they have to be there to stabilize the vaccine.
Okay, thank you. Thank you for addressing that. There's a question that came in from the audience that I want to bring up. With the hospitals now being full with sick patients, What are we doing about babies that need to be delivered? And how is this being addressed?
I can start from the queen side, and then you want to flip with the Kapilani side. It's not a perfect relationship, but it actually has been very impressive in my eyes, the way the hospitals have really come together to try to do what's best for the community. Fortunately or unfortunately, certain hospitals take a little bit more of the brunt of COVID patients. But what I do see, whether we're speaking about Queens, Kapilani, Kaiser, Tripler, is the moms that come into the hospital that are hopefully not COVID positive, that are tested. They are kept in areas that are safe and secure in every effort. And it is actually a pretty good effort, because we usually do not have, it's not impossible, but we usually do not have hospital caused COVID. And it is safe. It is safe to bring your baby in. And the way you, the community, make it safe for us is you allow the hospital to test you before you come into the hospital, so that if you do come in and you are positive, as Dr. Wong Ramsey explained before, no one is going to separate you from the baby, and you will not be treated any differently, but we will separate you from other patients so that you can experience a safe, healthy delivery where you will be breastfeeding your baby, but no one else in the group will be getting it. When it comes to safety, it is very safe to come into the hospital. It is safe to be tested. It is safe to get vaccinated, so that we can identify whether or not you need extra care as soon as possible. And that could be for the infant, whether born on time and is healthy, or maybe born a little bit early and needs to be placed at another hospital.
I'd like to have the Kapilani side, but I think part of that question was that people are hearing the hospitals are full. So how do we have to worry about room being made for women that need to deliver?
I thought you were actually going to go in another direction. I thought you were asking, should we consider home births?
Yeah, well, I guess you could say if the hospital's full, maybe we need to be doing more of those. But yeah.
Considered home births or alternative places. And I think that's a complicated question. I think right now in our state, we have some really incredible midwife RNs that are available, but we do not have large birthing centers to deliver away from the hospital. And I cannot emphasize enough, the hospital is still the safest place. And the hospitals, as I mentioned before, are working very hard together to triage patients and make sure that there is a room is available at the manger or the inn, I should say, when moms do come. But it is a concern.
Yeah.
Yeah, I guess
Dr.
you could
Wong
interpret
Ramsey, you
the
want to pipe
question
in on that?
different ways. Dr. Nadine Salle said, some hospitals are seeing a larger brunt than others. We know that COVID tends to hit older individuals harder, particularly adults, which is fortunate for us here at Kapi'olani Medical Center in that although we are seeing a rise in the number of children who are getting sick with COVID, we are not necessarily seeing the volume of COVID patients that other adult hospitals like Queens or Straw may be seeing. But that being said, we still are busy with a lot of patients who need other concerns as well, including women who are coming in to give birth. For right now, fortunately, we have been able to accommodate that safely, and there haven't been safety concerns about having space for women who want to come to Kapi'olani Medical Center and safely deliver their baby. But as Dr. Saleh said, I think one good thing is that I think we have good relationships with other hospitals here on our island. We already do have histories of helping one another. For example, if one hospital is full, they need help. Sometimes other hospitals may shift around and we may move patient locations in order to provide the safest and best optimal safety of patient care for both the patients and for our healthcare practitioners who are facing an unusually high burden of work right now in the hospitals. Everyone ranging from the physicians to the nurses, other ancillary staff like respiratory therapists are all working incredibly hard, especially as hospital resources are being taken up by a lot of hospital beds right now. I see there's another question, Jared. Do you both accept home birth babies as patients? I think that's a question for Nadine Salle, since I only take care of babies who actually come to the intensive care unit.
Right, because as I think you explained before, Dr. Wong Ramsey does only inpatient, and I do a lower level of inpatient and outpatient. And the home births, as I think most of my colleagues, I do accept newborns. I do try to work with my parents who elect to choose home births. And what I mean by that is it's important for me that when I'm accepting patients, that parents are really trying to think this through, trying to understand how complex it is to choose to do a home birth, to choose to vaccinate. And that vaccine question could be COVID, which this discussion is about. And it's also about the routine vaccines that should not be missed during COVID. And it's those families that I find are happiest in my practice, as opposed to the single question of home birth versus no home birth.
Thank you. Dr. Wong Ramsey, you mentioned the amount of kids coming into Kapi'olani with COVID and increasing numbers. There's some concern about long-term effects that might be, we tend to think of kids as not getting COVID and not getting it as severe and just minor infections. But now there seems to be some talk about possible long-term effects from COVID, especially, I believe, having to do with the heart. Can you talk about that a little bit, please?
You muted yourself.
Sorry. Sorry. So I think the term long term or long haul COVID is something that's becoming more familiar with people. As we've been living with this pandemic for about a year and a half now, we recognize that in some of our adult patients, they may experience symptoms after their COVID infection that may last for many months or beyond. Then questions arise, are kids seeing the same thing? Even though kids may not have as severe initial symptoms as adults, do they still carry long-term symptoms? There have been some preliminary studies from the United Kingdom looking at pediatric COVID infections, and some results have been suggesting that there's a good proportion of kids, maybe anywhere between like 20-40%, who are experiencing some types of long-term symptoms further on down the line. I think it's something we're still worrying about. Furthermore, we also know that there's another condition after COVID infection that we are worried about in children. This is MISC, the multi-system inflammatory syndrome seen in children after COVID infection. So children who initially get with COVID, they may not have some very severe symptoms initially, but a few weeks later, their body may respond to that prior COVID infection with a very large amount of inflammation. And this inflammatory response can affect multiple different body systems, including the lungs, the heart, the skin, the stomach, the gastrointestinal system. And some of these can have long-standing problems too. Some of these children with this may develop changes to their heart, which may last for a very long period of time. So there is definitely concern for COVID infections having long-term impact to the children. We know that the first time when we had our first wave of COVID infection, we didn't see that rise in that multi-system inflammatory syndrome in children until months later after we saw that initial peak. So I think a lot of my colleagues in the pediatrics world are concerned too. We are seeing a third wave now. Our numbers of infections here in Hawaii are been um, numerically increased from what they used to be. And we are worried further down the line, let's say months from now, are we going to see an increase in the number of kids who may be coming in with multi-system inflammatory syndrome? It's something to be seen and something we're worried about. But now that there is a vaccine available for 12 years old and up, and hopefully maybe by the end of this year, maybe even for younger kids as young as 5, this may be a chance to offer better protection from our Keiki against some of the more long-term serious effects of a COVID infection.
Thank
Could I
you.
add something to that, Martina?
Sure.
You know, as parents, when you hear about that, myocarditis, fluid or inflammation around the heart, multi-system inflammatory syndrome with the possibility of lasting for months, the term long COVID, in which even after you're better, it goes on and on. Those are very real. And as a pediatrician, I think we're going to focus on this, and we need to understand what is the long-term impact on our children and how to best treat it. And as a parent, it just strikes the fear in your heart as we go back to that question, should I send them to school? Is it worth it? My comment to the group would be two-part. Despite the serious of that, we need to think of this like a pie. And we're really talking a very small percentage of children actually go on to have those complications. The majority of children, and this is worldwide, do not die of COVID and typically do not end up in the hospital, much less in the ICU. So those concerns are real, but the majority of children who do get it will convalesce, meaning they'll get sick. They may even be seen in the ER, but they will be asked to stay home to get better. That being said, compared to the vaccine and what the side effects of the vaccine are, which means number one, site injection pain, that means your arm's all sore. Possibly that's your number one side effect. The other 3 side effects would be fever, muscle ache, and fatigue that typically might last 1 to 2 days. And those cumulatively a kid might see. That's more likely to happen than the complications of COVID. So the take-home message, if I can not making myself clear, the side effects and the risk of taking the vaccine are lower than the severe complications of getting these illnesses. And yet the benefit, not only to your individual child, but the community as a whole is so much greater as we're just balancing.
Thank you. We only have a couple more minutes, and I have a couple of questions that I'd like to address real quickly. One had to do with the percent coming into the hospital that's unvaccinated versus vaccinated. Could you address that real quick? And I also want to let our viewers know that there's a wonderful resource through the Department of Health. It's the COVID dashboard. And if you look at the COVID dashboard, you can get, it's just full of information on who's getting infection, the age, the sex, the ethnicity, the hospitalizations. So please check out that Department of Health COVID dashboard. I'm going to ask my panelists this question. You have 30 seconds to respond to that, and then I have 2 others that I'd like to address.
I can give you the numbers for today. So the numbers for today are 371 are in the hospital and 38 are unvaccinated, and almost 90% of the unvaccinated in the hospital have medical complications that likely would have put them in the hospital anyway. So what you're not seeing is vaccinated, healthy individuals ending up in the hospital.
But on top of that, among the pregnant women we're seeing who are getting hospitalized, generally these are otherwise younger, healthy women coming in pregnant. All of them have been unvaccinated, who've required significant hospital care.
So the bottom line is it's the unvaccinated that are coming into the hospital, and a lot of them have underlying complications that are aggravating it. We're not seeing healthy vaccinated folks coming into the hospital, and that's the bottom line. Thank you. There's a question here. What do we tell our families to do if they get COVID? How do we prepare for this?
If they get COVID, or to prepare from getting COVID?
How do we, did you already, How are you directing families? What do you tell families when the kids get COVID? How should we be prepared to deal with it? So I think they go to school, they come home with COVID. What do we as a family do?
Unfortunately, it's simple. The minute someone in your family gets COVID, your family is quarantined, and you will remain in quarantine until the last person is positive. So if the last person takes a week to become positive, you still got to tack on 10 days from the last person becoming
You mean positive for antibodies?
Meaning, in other words, the reason you know that your family has gotten COVID is someone had to test and become positive.
Right, and then you have to wait that quarantine, that 10 days, right?
So nobody goes to work, nobody goes out, and the family is in isolation. And it's very challenging because a lot of our families, a lot of our local families, you know, because we're seeing some of the highest rates on the west side. We're seeing the higher rates with some of our native Hawaiian, and I even have Micronesian families in my practice. And they often live in multi-generational families, and you'll hear numbers like 10 or 12 people in the household. That is extremely complex, not only just complex of who can get sick from very young to very old, but also the number of people who cannot go to work and bring in income during that period.
Yeah. So as far as they're homesick, what are we doing? You have to keep them in a separate room. Obviously, we're treating if they have a fever or a cough, you're giving them things to treat the fever or the cough, but you really have to keep them separated from the rest of the family, right?
In COVID,
eat separately, right?
In COVID 101, there was separation, there was hotels. To be honest with you, it is moving so fast and so rapidly that it has become impossible to completely isolate individuals, because often by the time that we find out, they've already exposed the entire household. So it's almost easier to quarantine the whole household at that point, as opposed to having people move to separate locations.
So if the whole household is quarantined, then that means they have to get food somehow. So there has to be somebody that's going to be able to bring them food. And you need to monitor to make sure they don't get worse, because then they might need to go to the hospital as well, correct?
Very true. In a lot of families, not everyone in the family has medical insurance and has a doctor that they can call upon. Maybe half the people have their own doc that they can call, and the others they were fairly young and may either not have medical insurance, or they've never really established themselves with a practice or a physician.
And then I think the other issue, if you have school-age children and they're in quarantine, and they're not set up, not all schools have robust online teaching available. Now they've lost how many days of school again, correct? Yeah, another issue. Somebody brought up, I think we're going to go a little bit over, if that's okay with the two of you, if you can stay with us for a couple more minutes, because there are questions coming in, and I think this is a very important, this is something a very important issue I'd like to discuss that comes in through our Q&A, and that's looking at the geographical breakdown of COVID on Oahu, with highest rates on the west side, where a large number of our Native Hawaiians live. How do you recommend we educate and encourage vaccinations in our hui who may be inundated by misinformation from social media?
Shall I take that, or would you want to take a crack at it?
I can do the first, and you can add on to. I think it's a great question, and something a lot of us here at Ahuhui are working towards, along with our partners at Papa Ola Lokahi, the Native Hawaiian Pacific Islander COVID outreach team, and many other community organizations. We know most people, including myself, are on social media quite a lot. It's a great place to connect people. It's a great place to learn about information. The downside is it can be very hard to determine information which is accurate and factual versus information which is false. And there unfortunately is a lot of misinformation that is out there. for some people in some communities, there is a long history of mistrust against certain organizations, government heads, and figures. We know that the American Academy of Pediatrics, the CDC, a lot of all of the other largest medical and public health organizations are strongly promoting vaccination, but these organizations may not have a history of trust with certain community groups, and understandably there's a long history of harms done between certain disenfranchised groups and larger medical institutions. And I think this is something where we as a community really have to pitch in and help and try to improve our efforts for outreach and communication, and look to see if who can be a trusted messenger to help spread the message. If the CDC and AP are not the appropriate messengers, are there other leaders who are well respected in our community who may be appropriate to help spread the information? That is one strategy we're looking at, trying to identify maybe different representatives or spokespeople, leaders who we feel may be role models to the communities. Um, other things to consider is our strategies. So we know that people who are hesitant to vaccines or maybe have beliefs that are not grounded on scientific evidence, when they are confounded with people who are trying to convince them to the contrary using opposite evidence, that sometimes is not always an effective strategy. Sometimes people may just bear down stronger on their beliefs and be very unreceptive to receiving new information. I think we have to think of it with aloha and love in our Ohana family approach, being patient and being willing to listen to people, being really willing to listen to what are their beliefs, what is their understanding, what is their understanding, and engage in kuka discussion. Let's share what we're understanding and about the situation, share information we understand, why we believe this to be true, and but giving time to hear the other person and validating why their beliefs may be different from ours. um, I think this is an area where everyone in our community can help. We know Hawaii is a small community, and sometimes hearing it from your brothers, sisters, aunties, cousins, or someone close to you, maybe your worker, sometimes that can make a big difference compared to seeing just a generic advertisement from the CDC or the AP. Sometimes people, it's really important to hear from someone who's close to them, someone who they love, someone who they trust. And for everyone out there who have someone they love who maybe has questions about the vaccine, I'd encourage you to make yourself available and try to talk together with others. It can make a big difference. I mentioned I'm pretty active on social media. I like posting different information tidbits. For those of you who follow me on TikTok or Instagram, I like to make a lot of funny and humorous videos while at the same time trying to provide some education. I'm really feel honored and blessed that some of my friends have actually sent me messages asking me my opinion or questions about things surrounding the vaccine. And I'm very honored to feel that that people, my friends, are trusting me to ask with some of these very personal questions. And I'm happy that hopefully I can help provide some information and help people provide make an informed decision regarding vaccinations in what Nadine Saleh mentioned is a very difficult time. Things are moving very quickly, both the vaccine and the pace of medical advancement, that it's is a very can be a very challenging and confusing situation for people when there's so much information out there. It's constantly changing. Even for us as physicians, I feel we're constantly trying to keep up with the latest recommendations and information out there. Did you want to add anything on top of that, Nadine?
No, I think you said it so eloquently and so well. And if there's any take-home message, this is not while it starts and it starts to sound like an individual decision, this is something that's happening to us as a community. And it's going to take us as a community, as you said, to help find the right solution that works for all of us. And it will require that we listen to each other, that we're respectful with one another, and that we hear where the other is coming from, and to move closer. There's no way this canoe is going to go forward unless we're all paddling in the same direction. No, I think you said it perfectly.
Thank you. We're almost at the end of our time, even with the extension. I'd like to really thank you. I know there was something that the two of you would like to share with our audience, and I would like to give you the opportunity to share your parting thoughts with everyone.
So Dr. Salle and I created this last slide here just to end with a few closing thoughts. We've talked about a lot of different topics today, ranging from breastfeeding to schools to helping to spread information about vaccines. And these are some closing thoughts and something we hope that our audience will take forward with you, and hopefully talk to your friends, talk to your families about things you may have heard here, and continue to help us move forward together as a community here in Hawaii through this pandemic. So remember that the COVID vaccine, it is safe for children age 12 and older. It has been proven to prevent serious illness or death. Although there have been reports about heart problems after vaccination, this is very extremely rare, about 1 in 100,000, and the vast majority of them have recovered, made a full recovery within just a few days, compared to some of our Keiki who've had the long-term COVID or the MIS-C complications. And contrary to popular belief, there is no evidence for fertility problems after vaccine. I always like to point out that, in fact, in the early trials of the COVID vaccine, there were several women who actually got pregnant during the vaccine trials, even though they're on birth control and made a pledge not to get pregnant while they're in the trial. Furthermore, COVID vaccine, if you do get pregnant, is safe for pregnant women and also safe for breastfeeding mothers, and may help protect both the mom and the baby from infection. We know that in-person school helps children tremendously in terms of their social, psychological, and development, in terms of neurological outcomes. And we can try to do it safely. We know there's literature out there from earlier this year in the pandemic, showing that schools that have employed universal masking, distancing, cohorting, there were a lot less numbers of outbreaks there compared to schools who didn't. Mask wearing is safe for children 2 and older. There is no problem with difficulty breathing. Children who are developmentally normally, if they're having a hard time breathing, they will remove the mask themselves before they experience severe medical harm. So it's okay to have children wear masks. If your child is sick with COVID, speak with your pediatrician. I know one of the questions in the Q&A that we didn't quite get to is, if your kids do get infected with COVID, beyond just quarantining them home, how do you take care of our Keiki? So your pediatrician is going to be one of your number one resources. Call your pediatrician's office or call them after hours at any time if you feel you are worried about your child or you have questions about the care your child should receive. And your pediatrician can advise you on further care, whether they feel it's safe for your child to remain at home or whether they think you should bring your child in to the office or to the emergency room to be seen for complications. Even after your child has recovered from COVID infection, like we mentioned, we do know that COVID infection can be associated with some more long-term heart problems. So before you allow your Keiki to return to sports or other really vigorous athletic activities, please talk to your pediatrician first and get your child seen, so then the pediatrician can do an evaluation of your child, especially with an attention to their heart, to make sure that it is safe for your child to return to their normal physical activity and sports before going back. Anything you'd want to add, Dr. Salle?
No, this is a fantastic slide, and Kara deserves credit for putting the slide together. The one thing that I would just say to the audience is, I think we tried hard to go after some of the common misinformation or things that we thought needed to be addressed so that people could understand what the facts are. But for every bit of misinformation that we address, there's another one. I would suggest to anyone who's on the call that is trying to decide whether or not the vaccine is a good choice for their child, make a list of all the things that you're worried about. every single thing that you think would be a big problem, reach out to your pediatrician. That's what they're there for. So I think Dr. Wong and I tried to discuss some of the more popular misinformation that is out there, but I'm sure there's more. Make a list, go for it, find out what the facts are, and based on the facts, then make the best decision for you and your children.
So our two amazing, what amazing resources for our community. I can't thank you two enough. And before we leave, we have some very important information we want to share with you about some upcoming events. And I'd like to turn it over to Kim Burney from Papa Ola Lokahi, who's been helping us in the background with this program, to share some really some other helpful resources that will be coming up in the future for you. So please stay on. Kim, I'm going to hand it over to you. Mahalo nui again.
Thank you, Martina, Dr. Kamaka, Dr. Wong Ramsey, Dr. Tenn, Salle. You folks were so smart and so articulate and so respectful and understanding of everything that I know you know what the issues are already. So this is the first of a revival of the Ask-A-Kauka webinar series. It's a partnership of Papa Ola Lokahi, Ask-A-Kauka, which is the Association of Native Hawaiian Physicians, and NCAPIP, which is the National Council of Asian and Pacific Islander Physicians. It's a partnership, and it is being presented with sponsorship from the Walmart Foundation and also from the CDC Foundation. So I want to make sure that we get that in there as well. Papa Ola Lokahi, with support from the Department of Health, is presenting 2 more in a series of 4 on hurricane preparedness. Ka'iolani Odom is the speaker tomorrow at 3 o'clock. We have Tangaro from Hilo Community College, who is presenting number 3 next Thursday on the Ka'au Learning Series. We have September is Recovery and Healing Month, and we have a series put together with the folks from the former Imi Keola Mau. The new series is called Imi Keola Mau Mau, and this starts August 31st. We've got this on our social media. Executive Director Sherry Daniels is talking with an Asian Pacific Islander group on September 7th, just a morning talk story. For us, it's morning talk story. Hawaiian History Month is in September. Dr. Kamaka and I are putting together week number 3, History of Hawaiian Health. We've got some great presentations that we are finalizing. We don't have the names there because we're still finalizing a few, but we're really excited about it. And our next Ask-A-Kauka, we'll be announcing those within the next couple of days. Next Friday, August 27th at 4 o'clock, Dr. Mahelani Lum will be talking about kupuna care. On Friday, September 10th at 7 p.m., we have Dr. Rennie Soon and her colleagues talking about wahine care, some of the issues that were brought up tonight about women's fertility and so forth. Dr. Soon and those colleagues will be addressing that on Friday, September 10th in the evening. So mahalo nui to our fine doctors and to all of you, to the audience. Thank you for joining us this evening. Take good care. E ola mau. Aloha.
We're